All right. Good morning, everyone. Dr. Randall Gates, board certified chiropractic neurologist, also a chiropractic physician at Gates Brain Health. Today we are talking about depression and gluten. So let's take a few moments here to let everybody join. But I love this picture. Melanie found this picture, and it's emblematic of what we're talking about today. The concepts of connections between gluten and depression were almost non-existent 10 years ago, being out in the mainstream. However, over the last 10 years, there's been this explosion of an entity referred to as non-celiac gluten sensitivity. Celiac disease is a condition affecting the gastrointestinal tract, primarily as it's known in mainstream healthcare. We're actually finding that celiac disease often affects the brain, the peripheral nerves, other aspects of our physiology. And so celiac disease, though, is where the immune system attacks primarily the gastrointestinal tract, where when somebody eats gluten, their immune system literally mounts attack to where you'll see a blunting of villi and the intestines. So the villi, the intestinal villi, are like little fingers, and they help us to absorb nutrients. And in celiac disease patients, they start to look like this. And then on microscope slides, we'll see a lot of immune inflammation in those nubbed fingers, so to speak, representing the intestinal villi. So that is celiac disease. However, that's 1 out of 100 people now. It used to be 1 out of 1,000, but for some reason now it's 1 out of 100 people, which is raising a lot of people to question why that is. Is it some sort of change in pesticides that we're using in foods? Or is it a change in the gluten molecule? And with that, a number of people around, I don't know, let's say it this way. In 2014, I believe 100 million Americans tried going gluten-free. Probably in the late, 2005 to 2010, you started hearing about different celebrities going on gluten-free diets and feeling better. They were gluten-free, dairy-free, and they were losing weight, and they felt really good. So that prompted the quote-unquote fad diet of just being gluten-free, and a lot of people started dipping their toe into it. And I was kind of, in the mix in that. I'm not saying that I was putting it out there. I'm just saying that around this time, I started working with patients who we, put them on gluten-free diets and seeing how they were doing. And people were having remarkable changes. Not everybody, but a number of people were feeling considerably better. So I was not surprised then from 2010 to 2015 to see this transformation. And so around 2014, I'll present that article. A gentleman, I believe he's out of Australia, basically demonstrated that people who have gluten sensitivities, who eat gluten and they don't feel well, it's because of gluten affecting their brain more than it affecting their gastrointestinal tract. So let me just see here and scroll over to Facebook. And good morning to everybody who's joined. And I will keep going on this presentation. Okay, so let's see here. Let's go to present from beginning. So this is the article I was just mentioning. So Peter, I believe his first name is Peter Gibson. He did a lot of the formative research on this entity called non-celiac gluten sensitivity. Now, anytime you have a condition where there is not a biomarker for it, it's going to come under a lot of scrutiny. By that I mean, some people with gluten sensitivity or non-celiac gluten sensitivity will have gliadin antibodies. Back up. For celiac disease, we diagnose celiac disease based on blood markers referred to as the TTG antibodies, referred to as tissue transglutaminase antibodies, anti-endomysial antibodies. You have to look at the IgA total for the testing to be accurate. And then usually combined with an endoscopy where the gastroenterologist cuts out a piece of your small intestine, and then they look at it in a microscope and they look to see for the blunting or the villus atrophy, and then a high level of intraepithelial lymphocytes in the intestinal villi. Now, if somebody has an off-the-charts reading of their TTG antibodies, that's usually enough for the doctor to conclude, even without an endoscopy, that somebody has celiac disease. I'm just saying that clinically. But technically, you're supposed to do the blood test and the endoscopy. Now, there are also things called Gluten antibodies. Now, Gluten antibodies are basically antibodies to gluten. They're not necessarily pathognomonic for celiac disease, but they can be part of the workup. So patients who have this issue where they eat gluten and they feel worse, referred to as non-celiac gluten sensitivity, sometimes have gluten antibodies, sometimes they don't. And the gold standard for diagnosing non-celiac gluten sensitivity is basically you go on a gluten-free diet and you see how you feel for 4 weeks, 4 to 8 weeks, and then you bring gluten back in and you see how you feel. So that poses a big challenge for the scientific community because they like to be exact and they like to know down to the most minute details what is going on, and that's a good thought line or a line of thought. But anyways, that's where this entity comes under a lot of scrutiny. So here, Peter Gibson, who was a foremost researcher in non-celiac gluten sensitivity, he did an article right before this one came out. And in that study, so to speak, he took irritable bowel syndrome patients who have bloating, constipation, diarrhea after they eat foods, who said they felt better being on a gluten-free diet. And he, in essence, told them he was giving them, I don't think he told them what he was feeding them, but he said, it's probably gluten-free, maybe it's not gluten-free. And so it was a 3-day period in which they would either eat gluten, they would eat gluten and dairy, or they wouldn't eat gluten. And he would look to see how they felt. And basically, when the people didn't know what they were eating, they weren't able to say gluten caused their gastrointestinal symptoms. He did find that when the IBS patients consumed gluten and dairy, their IBS symptoms were worse, but gluten by itself, no. However, and so that hit the mainstream media, and basically there are a variety of articles that came out saying, gluten researcher now questions validity of the gluten problem, things like that. And what did not get published was this study, or let me say it this way. It was published, but was not published in the mainstream media, was this study. So this is out of Elementary Pharmacology and Therapeutics, where he, in essence, looked at these same individuals. I believe it was the same individuals. Maybe it was a replication of the first study. And these are IBS patients, and he did the exact same thing. And what he did find, you can see in the conclusions, short-term exposure to gluten specifically induced current feelings of depression with no effect on other indices or on emotional disposition. Gluten-specific induction of gastrointestinal symptoms was not identified. Such findings might explain why patients with non-celiac gluten sensitivity feel better on a gluten-free diet despite the continuation of gastrointestinal symptoms. So in essence, he's saying what he found is that people who eat gluten and they don't feel well, it's not as much because their gut doesn't feel well, it's because their brain doesn't feel well. And he controlled for a lot of variables. It was a great study. He was looking at cortisol levels. It's fantastic. So anybody who's interested, here's kind of a landmark study, so to speak, on gluten and depression. Now, there have been a number of other associations throughout the years since then about gluten. I'll go into just a couple of them. This is a great article looking at the scope of TTG antibodies in neurological disease. Now, TTG antibodies, again, are more associated with celiac disease, not necessarily non-celiac gluten sensitivity. But I just wanted to highlight here that if you read right here, TTG6 antibodies are more prevalent in neurological conditions. So basically, TTG6 antibodies target neurological tissue. They damage the cerebellum, they damage peripheral nerves. And here it's quoted that, let me see here, I just lost my place. Providing a link between autoimmunity to TTG6 and brain atrophy in patients with celiac disease. So here they basically showed that 40% of celiac patients had TTG6 antibodies, and that these TTG6 antibodies, even though everybody's focused on the gut for celiac patients, they're going rogue on the nervous system. So they can cause brain atrophy. Again, they can affect the peripheral nerves. So anybody you know with celiac disease, it's important for them to be aware of the neurological side effects. Now, throughout, I can't bring in all the articles that I read, but I try to bring in the big ones. So there's a question of how does somebody eat gluten and then they feel worse cognitively, they feel depressed, what is going on? We actually really don't know the mechanism yet. This is a theory, a hypothesis, so to speak. This is how the journal hypotheses. And they're talking about how the gluten molecule looks very similar to the grina protein. The grina protein is in the NMDA receptor for glutamate. So I'm going to do a talk on glutamate and depression coming up. But I talked about it in a schizophrenia broadcast many months ago, where a third of schizophrenia patients, for example, have gluten antibodies. And these gluten antibodies go into their brain much more so than gluten antibodies in people without schizophrenia. And these gluten antibodies bind to grina proteins on NMDA receptors for glutamate. Okay, that's probably a lot. Just know glutamate is the main excitatory neurotransmitter in your brain. You've heard of other neurotransmitters like serotonin, dopamine, norepinephrine. Well, glutamate is the main excitatory neurotransmitter in the brain. What we find is that when people are under high levels of stress for long periods, let me see if I can grab my brain model here. When they're under stress for long periods of time, the high stress levels, actually the high cortisol levels or adrenaline, will actually cause atrophy in the prefrontal cortex. It can cause atrophy deep down in the brain in the hippocampus, the memory area. And they're finding that what happens is that glutamate signaling becomes very abnormal in the presence of sustained, chronically high levels of cortisol and adrenaline. So that's where now new therapies targeting the glutamate receptors, namely the NMDA receptor, seem to be showing promise. There are different types of receptors for glutamate. One is called NMDA. NMDA is very important because it causes a bunch of downstream signaling within the brain cells. So the point is that the gliadin peptide basically looks very similar to this grina protein, which is on the NMDA receptor. So there may be a link that has not been discovered yet. I'm just hypothesizing too, along with this journal, that maybe people who have non-celiac gluten sensitivity, maybe they're forming some sort of gliadin antibodies that are affecting the NMDA receptor. Maybe. I don't know that for sure, but it's a maybe. It's just a thought. Now, this is a nice review out of the journal Nutrients 2018, where they said mood disorders and gluten is not all in your mind, a systematic review with meta-analysis. And so they basically go through it and they say our review supports the association between mood disorders and gluten intake in susceptible individuals. And here they looked at several different studies. I think they had a total sample size of over 1,000 people, and they concluded that there is a strong association, or there is an association between mood disorders and gluten intake in susceptible individuals. The effects of gluten-free diet on mood in subjects without gluten-related disorders should be considered in future research. Again, I'm going to say that again. The effects of a gluten-free diet on mood in subjects without gluten-related disorders should be considered in further research. So this raises a point where non-celiac gluten sensitivity is around 10% of the population. Some studies say 5%, some studies say 18%, but let's just say 10% of the population eats gluten, and they generally say, I don't feel well. I'm one of those people. I eat gluten, I just generally don't feel well. And so, but to my knowledge, I don't have celiac disease. So what they're saying is, okay, well, if these people eat gluten, they don't feel well, maybe we should start extrapolating this into looking at this group of depressed individuals in our societies, about 16%. And we really need to start researching, is gluten a feature of depression? Gluten seems to be associated with depressive symptoms in those who are sensitive to it, but is there an overlap? Yes or no? Maybe, maybe not. point being, if you know somebody who is suffering with depression, that's the whole reason I'm doing these like 10 videos on it, is that about half of them are going to respond to medications if they want to take a medication. And that is wonderful and that is fantastic, because depression is a horrible, let me say it this way, it's an illness with a lot of suffering for any of you who know someone with depression. And depression is not just someone who feels sad for a couple days. Depression is somebody who feels quite sad for at least 2 weeks. Lots of times it's months on end, and they don't enjoy hobbies or activities. They tend to not sleep well. They have poor energy. They tend to lose weight. They tend to gain weight, and other symptoms. So depression is a very, very serious condition, and unfortunately about half of depressed individuals won't respond to medications in the long run. That's referred to as treatment-resistant depression. It depends on who you talk to. It could be 40%, could be 50%. But the percentage of people who are depressed who develop treatment-resistant depression is pretty high, which is why the psychiatric world has been studying all these other nuances seemingly far removed from the brain, including the gut microbiome and how much fat you're carrying and what your inflammatory levels are and what your hormones are looking like and what's going on with your thyroid and Hashimoto's, and now we're talking about gluten. So we have to look at all these disparate pieces to explain maybe why someone wouldn't respond to medications, and maybe gluten might be the feature of someone's depression. So it's just interesting information. If you know someone with depression, I think it's always good to start these discussions and get it out there. I think it's very important. So there's our information. Like, subscribe our YouTube or our Facebook or Instagram. If you have any questions, you can email them to us at the info@gatesbrainhealth.com email. And let me come back over to Facebook and see if there's any other comments. And again, great seeing everybody this morning, and thank you for all the nice feedback. And yeah, and we'll be back Saturday. And thank you as well. Thank you everybody who's joined. And we'll be back Saturday with another broadcast. I think it's on hormones and depression. Don't quote me. It's in the newsletter going out today, so or it may have gone out yesterday. So anyways, our newsletter's going out, and it has a detail of the talks that we're doing Saturday and next Wednesday. And I'll probably have a synopsis of this talk written in the newsletter soon. All right, everyone, have a wonderful and safe Wednesday, and we will see you soon.